Many people today are not fully aware of the many types of birth defects that can happen to newborns until it happens to them or someone they know. Today, I would like to inform you about one of the most common types of birth defects known as neural tube defects. Neural tube defects are when the baby's spinal cord does not roll up and form a tube. This occurs 28 days after conception. Many women do not even know that they are pregnant at this time. There are two types of neural tube defects, open and closed. Open is when the spinal cord and brain are exposed at birth, such as spinal bifida. Closed is when the spinal cord and brain are covered by the skin, known as tethered cord. Birth defects in newborns can be very sad and frightening, such as neural tube defects. Although genetics does play a role, some people are not aware that there is a way of prevention. But prevention starts before conception. The way to prevent neural tube defects is by adding folic acid into your diet before conception and after. Throughout research, doctors have found that 50 to 70% of women can prevent neural tube defects by adding folic acid into their diet. Folic acid is a water-soluble vitamin B. The recommendation for women once you are around childbearing age is 4 milligrams of folic acid. Women who are thinking of trying to conceive should make sure they have folic acid into their diet. They should make sure to continue having folic acid into their diet for the first 3 months of pregnancy as well. Of course, women should check with their doctor about taking folic acid. They should ask them what it does and how it will affect them. Genetics does take a role in neural tube defects, so prevention will not always be possible, but of course it is better to try than not to. Neural tube defects are known symptoms of genetic syndromes such as Meckel-Gruber syndrome, trisomy 13, trisomy 18, and certain chromosome rearrangements. Also, once you have had a child with neural tube defects, your chances of having another increase by 2 to 5%. Even though your chances are increased, women still have a chance of prevention for neural tube defects by doubling the intake of folic acid. Obviously, we cannot always stop the defects that occur in our newborns today, but we can at least try. I know we all want our children to be nice and healthy. To do this, we must try and prevent them from all the possible. Thank you for listening, and I hope that I have shown you how you could prevent one of the most common birth defects known as neural tube defects. That was your best one.